YouTube. Hello, everybody. Recording live from somewhere. This is Zach Couples with episode number 21, Blackjack City, baby, of the movement Debrief. And we got a humdinger today. We're going to talk about all types of cool stuff, such as thoracic outlet syndrome. What do you do for that? We're going to talk about advice for new graduates. And we're going to talk about some interview questions that I enjoy asking interviewers. But before that, some housekeeping. Did you guys see the blog that was posted this week on zachcouples.com? This was like, I think the second guest post I've ever had done. And it's kind of like, you know, how Nas on the album Illmatic only had one feature, and that feature was AZ. Well, Benjamin Fergus is my AZ on the Illmatic called Year 2.0 or version 2.0 of zachcouples.com. And he absolutely killed it with this blog post. I really enjoyed all the things that he talked about with the squat. Really good. Like I definitely learned a lot of cool things from it. So you guys should check it out and check him out at Grip Approach. He puts on continuing education classes. I haven't taken any personally, so I can't testify to what they're about. But I can testify to Ben Fergus in the sense that he's a pretty smart cat, because I have met him a few times at a couple DNS courses that I took back in the day instead of the back of the day. So that's that in terms of housekeeping for the website. Otherwise, going to the land of China pretty quick, and I just finished writing and doing the PowerPoints for my 2 talks. My hope is that I get to put those out for you beautiful, sexy people. It's probably going to be for newsletter peeps only. So if you haven't signed up for my newsletter on zachcouples.com and you want access to exclusive stuff, you should probably go check that out. So that's that. Another thing housekeeping-wise, I announce this every once in a while, but I definitely want to announce it again. Next September, I believe it's the 19th and the 20th. Let me check. September 2018. Wow, I'm way off. 22nd and 23rd. If you are in Seattle, screw that. If you want to go to Seattle on September 22nd and 23rd, my main man, Michael Lee, is hosting me, Zach Couples, to be teaching a 2-day seminar of all types of ill things. What's it going to be about? Stay tuned. Actually, I mean, it's probably going to be about some PT-oriented stuff, but who knows? I mean, I got a bulk of it done with these 2 talks, so that'll give you a little bit of a sneak preview about what's to come live. So put that on the calendars. Seattle, September 22nd, September 23rd. I want you there. Other than that, I think that's all I got for housekeeping. So let's debrief. First question. These are all Q&As from some people. And if you guys have questions at all at any point during this debrief, fire away, because it is live. I see you, James. I see you. How you living, man? I heard you moved to Idaho. Hopefully it's going well. So first question is from Brian. And Brian asks, hey, Zach, what do you do for thoracic outlet syndrome? I'm like, oh, no, not this question. And the reason why I say that is because nothing wrong with Brian's question, but it's just, first off, let me preface this. I think because thoracic outlet is such a nebulous term and diagnosis, and if you look at the literature, it's quite controversial. I don't know if I can say that I've seen someone with legit thoracic outlet syndrome. That said, if we think about the anatomy and we think about my thought process when I'm treating anyone, I don't think that the diagnosis is necessarily relevant in this case. Let me unpack that a little bit. So when I'm evaluating someone, my first thing that I do at any point in time is answer this one question. And the one question is this: can I help this person? And so let me give you an example of someone who I can't help. Let's say I'm seeing someone and they just popped their ACL. I would use my clinical diagnostic testing and my thought process to say, oh, this probably isn't something that PT is going to help. You should go see this person, right? Or we could use some of the diagnostic criteria for cancer as an example, which would be, previous history, certain age ranges, unexplained weight loss, not getting better over the course of 3 months of treatment in terms of symptoms. Like, these would be things we would need to know as clinicians ahead of time to say, this isn't for me, you need to see someone else. But if you got that cleared, and for some case in thoracic outlet, it's like, okay, you don't necessarily need to know what the diagnosis is, you just need to know what it's not. And so can we ask ourselves, is thoracic outlet one of those examples? And I don't know if I would say that's necessarily the case, because if you look at the research, the surgical procedures for these types of diagnoses is absolutely poor. So you don't need to see a physician for that. Moreover, let's think about what potential mechanisms might be in play for someone who has thoracic outlet syndrome. And basically what that would entail is potentially some type of entrapment of the brachial plexus or subclavian artery, which is why you might get some changes in the hand from a blood flow standpoint. And so there's a few different spots that you could potentially have compromise of these vessels. One could be in the interscalene triangle, so in between the scalenes, that's where a lot of those vessels pop out of the neck. You could have basically, anywhere along the plexus, but you could also have pec minor is another possible place, the subclavius muscle. These are all places where these vessels pass through. And so let's think about, again, is there anything with any of those locations that could potentially be problematic from a I can't help this person standpoint? And unless it's cancer or some type of cyst that needs to be removed or any of these things, the answer is probably no. So assuming you've done a good exam to rule out bad stuff, what do you do from that standpoint? Well, we know that these tissues could potentially be implicated, but we also know that when there's neural compromise somewhere, you don't necessarily know the exact location, because generally you get neural involvement somewhere and that just bothers everything. And so for these people, what do you have to do? You have to restore joint variability at all the relevant joints. So do they have full neck motion? Do they have thoracic or thorax flexibility of the rib cage, first rib? Do they have full shoulder motion? Do they have full motion down the rest of the arm? You want to be able to check all these things. And if you don't have those boxes filled, use whatever you have in your skill set to address that. So that would be step number one. Now, if it's me treating this person, we know that pec minor, we know that the scalenes are highly involved in respiration. And if you have someone who either has a... James, man, you spoiled it. No, I'm just kidding, Pam. Yes, ZOA for sure. But so if I have an individual who is in a position of extension in the rib cage, and so they get to a point where the diaphragm has descended to a very far degree and we get increased accessory muscles kicking in for respiration, that's going to be really tough to shut off if that's not addressed. So you'll want to look at respiration with a lot of these people, because if you can get someone a zone of apposition, so you get the rib cage to drop down and allow the diaphragm to ascend. And for those who don't know what a zone of apposition is, that's the amount of diaphragm tissue that lies adjacent to the ribs, which we want to maximize. If you don't have that, then you're going to be accessory muscle city. So you have to get that first, okay? So let's say you got a zone of apposition, and maybe you got a little bit of reduction in neuromuscular tone of the scalenes, even though, sidebar guys, scalenes are actually a primary muscle of respiration. We're looking at overactivity. And maybe you got pec minor to let go, and let's say you restored joint variability of all the relevant joints. and you still have symptoms. What's the next step? In this case, after I've restored that and maybe there's no change in symptoms, I'm going to go after and test neurodynamics. So how well does that encompass the brachial plexus slide, glide, pinch, compress, elongate, all of these things? How well do the nerves do that? And so you might incorporate some type of neurodynamic test to determine how well the nervous system is moving, or even tolerating load. That's another thing you want to think about. And so, for example, let's say your individual who has thoracic outlet gets pain, only when they're doing some type of loaded overhead movement. Well, maybe for those people, what you do is, instead of your classic, upper limb tension or upper limb neurodynamic test, whatever, whether you do median, the base test, ulnar, whatever's involved, maybe you just have them press the weight and then see if you do some type of structural differentiation, if that makes an impact. If it does, then you actually probably have your own neurodynamic exercise right there. And maybe, as crazy as it sounds, now I'm not advocating this to do this to increase power and capacity, but maybe you just have them press and work on doing sliding and gliding under that context. Because what I've found as I've done a lot of neurodynamic interventions is that the context of the movement is important. Not necessarily doing just these basic slides and glides. You want to do it in the movement that is meaningful to the patient and reproduces their symptoms. So like when I was in the league, I had a guy who was getting like some spot pain right here and right here, for those who can't see. I'm sorry, the camera's kind of crappy. But it seemed as though that a lot of his median nerve testing was involved early on. And so we did some basic sliders and stuff like that and seemed to clear up. And then it wasn't about a few weeks later, but he got it again. And this time his neurodynamic stuff was fine. This guy had joint variability restored. So what I had him do this time was I said, well, okay, show me the movement that bothers you. And it was doing some type of one-arm pass. He's like, I feel it there. And I said, okay, tilt your head and then do it again. And he did that, and lo and behold, the symptoms were gone. And so what was his slider? I mean, it was passing like this because the nervous system needed to tolerate or be exposed to X amount of load before symptoms were reproduced. And so if you can impact neural excursion within that type of loading strategy, then that's when you're going to give the nervous system the movement, space, and blood flow under that particular context and teach it to tolerate loads in that particular context in order to be successful. So you've ruled out bad stuff, you've restored joint variability, you've taught the nerve to tolerate various types of excursion. After that, if you still got some symptoms, then you're probably going to look at some power and capacity kind of things to build. So, ask yourself, how long is it before they get symptoms? Maybe it's, I don't know, after 2 hours of activity X. Maybe it's only when they're producing X amount of force and you've already done the neurodynamic stuff and that hasn't made an impact. I mean, that is exactly the treatment paradigm that I go through with pretty much any patient, regardless of diagnoses, assuming that I've ruled out bad stuff. And if they're not getting better as they go along that continuum, then maybe that warrants a referral, or maybe there's other things within the body's systems that are going on. Maybe there's something that needs to be addressed dietarily, or maybe they have some type of systemic inflammatory condition going on, or maybe they're not sleeping well. I mean, you just kind of have to look at the whole picture, and really as clinicians, it's those 4 areas, or 3 areas that I mentioned, variability, power, and capacity, that we're addressing with anyone. And so for your individuals who have TOS, just hit up those things and hopefully you get a change in their symptoms. So Brian, very good question. Thank you for that. That's number 1. Need a drink after that one. Question 2. This is from James. I apologize, James, because he asked a question on YouTube while I was doing the last debrief, And for some reason, I wasn't looking at the good old YouTube. So, Monica, mad love for you. Thank you. So this question pertains to some of the job advice stuff that I was giving, I guess. And he asked, hey, Zach, I'm a new grad. What do I do for negotiating in these cases? And so I kind of took that question. I said, you know what? That's a very good question, but let's expand upon that to just new grad advice, or as Arnold would say, advices in general. And so, first off, let me answer his question. No, let me not answer his question yet. First off, you're a new grad, okay, and you're in the job search. What are some important things you need to consider before you even get there? Make sure you are networking before you get out into the job market. And so be a genuine person with your professors. Be a genuine person with people you come across at continuing ed, or if you're going to conferences. Just meet people. Be genuine. Try to help them, because those guys could be advantageous to you in sense of finding you a good job. So you'll definitely want to do that first and foremost. When I had my first job after my residency, the only reason, well, there was a couple of reasons I probably got it, but one of the big reasons that I got it was because this person was an alumni. And so, we had a mutual connection. And it was because of that mutual connection and because of the fact that he was an alumni of where I went that I was able to get the job, fortunately. And so that's another thing you can think about leveraging too, is reaching out to alumni from your school, because that's probably the one beneficial thing you can get from going to a particular PT school, is you automatically have a built-in network. And if your professors will vouch for you, winning at life. So leverage your school's network, build your own network. Those would be the big two things. Another thing to consider, because the problem that I think James is alluding to is, well, I don't have experience, which a lot of times is bullshit. I don't have experience, but what do I have that's valuable to an organization? That's probably the more important thing, because if you have an individual, and a great example of this is my good friend Eric Otter, who, I'll tell you what, he landed a pretty sick job in Memphis despite not having any experience in pro sports, and he's absolutely killing it. Why is he killing it? Because he has things that are assets himself and his knowledge base that is valuable to an organization. And so what are your assets that you have? Maybe you're a good public speaker. That's actually another reason why I got the job, my first job out of PT school after my residency, is because I was giving a talk and he was there, my future boss. And so I had the perfect storm of, we were alumni of St. Ambrose, we had mutual connections, and he heard me speak. So I had something that was valuable to him, because I did a lot of public speaking for clinicians, or not clinicians, well, actually I did. I put on a little con ed course, but clients and potential patients. And so that was something that demonstrated value. Other ways you can demonstrate value, well, if you go back to last week's debrief, which I'll link in the show notes, that'll be on my website. If you go to last week's debrief, I mentioned the briefcase technique that Ramit Sethi hooked me up to. And basically, for those who didn't listen last week, why not? But for those who didn't listen last week, basically what you do is you develop a running tally of things that your company needs to get better at. And you develop solutions for each of those things. And so if you present this to a potential employer and you have an action plan and timelines determining when you're going to, or what you're going to do for this company, hell with experience, you have solutions. Those couple things are going to have your potential job location salivating at the mouth for you. Because that's the biggest thing. It's not experience, it's value to the company. Because there's a lot of therapists out there who have a lot of experience but don't offer any good value to a company. And I could think of several clinicians that I know, or newer grads, who offer tremendous value and are oftentimes being recognized for that value despite inexperience. So forget about experience. It's all about value. And so you can use those things to leverage when you are in negotiations with a new company. Other things to consider. Play the field, fam. Make sure you have some competition, because you can still use that as leverage, because you are throwing at this company, wow, I can solve all these problems for you, and even though I don't have experience, I got this skill, and this skill, and I gave this presentation at CSM and blah, blah, blah. Oh yeah, and by the way, you're only offering me $65,000? Well, I'll tell you what, my man, if you want me that bad, I got a company over here who's offering me $72,000 plus better benefits. And then you just shut up and wait and see what they have to say. Because if you throw competition and you say that you are a solutions person, you're going to be in a pretty good spot. So those would be some of the recommendations I would make for a new grad who is in these negotiation things. Don't let your inexperience be considered a negative, because you can always get that. There's certain intangibles in terms of your interactions and some of the skills that you may possess and even connections you have that you can leverage the hell out of, and that will get you far. Because I can tell you this, now granted, I'm not the job-getting expert by any means, but I've gotten quite a few pretty good jobs and been put in a few good spots despite not having much experience. And that's because I've demonstrated value other ways, whether it's this stuff, whether it's my public speaking abilities, whether it's some of the continuing education that I've done. I mean, it's all these things that matter. It's just you have to demonstrate that you're valuable to the organization you're looking for. Now, all that being said, one thing I would consider if you are a new grad and you're unattached, try traveling, guys. I mean, this is a pretty sweet gig, especially if you have student loans, which most of you guys do. Traveling is tough to beat. It's probably one of the higher paying PT jobs you guys can do. And one big thing I would tell new grads, because I didn't do this, is pay off your student loans as soon as you can. You can always get more experience, but it's really tough to beat compound interest. And if you have student loans, that's going to limit potential jobs you could take. So for example, there might be a phenomenal job that has everything that you want to do, but it pays for shit. And maybe you can't take that dream job because you don't have the funds to be able to do that because of your student loan debt. So please pay that off as soon as you can. I guess I can't say it was a mistake, because I obviously spent a lot of my first few years trying to learn a lot, and I spent a lot of money on Con Ed. You don't even want to know the number. But because I did those things, I forsaked paying off my student loans, and so I was doing minimum payments. And compound interest kind of sucks, guys. I'm having to end up paying a lot more money over the long haul. And for me, it has limited potential jobs I thought would be pretty cool, but because my bigger goal is to pay these loans off, or maybe I couldn't live by the means I wanted to because of those loans, that it's a limiter for opportunities. So something to consider. At some point, I plan on doing a conversation with my man, the Dolph, Randy Bowling, about travel PT for you guys, because he's been traveling for almost 10 years, because he's old. And he's a good knowledge. He has a great knowledge base about all the ins and outs of that. So if you are a new grad, I would strongly encourage you to travel. If you aren't going to do that, another thing I would consider, pending your domain that you want to practice in, make sure you go to a spot that has good mentorship. Because I think that's very important that first year, because that's that's a critical time period in the sense where you're developing a lot of your habits as a practitioner. And if you have someone to mentor you throughout that process and guide you towards complex cases and teach you what it means to be a physical therapist, that's stuff that I would say is probably even more important than student loans, or even more important than a high-paying job, because that's really what's going to set up your career for success in the long term. And if you can't get in a position like that, where you're not finding the clinic that you want or the location that you want, and it doesn't have the mentorship, you can always find a mentor online, like this guy. But I know there's a couple other people who do some mentoring as well. So you just want to make sure you have someone who you can bounce ideas off of, that's well versed in the field of physical therapy or whatever field it is that you're working in. So to summarize that, leverage your strengths with your new company, demonstrate that you're valuable, use competition, consider travel, it pays well, and make sure you got a mentor throughout the whole process. And I would definitely encourage keeping a mentor even beyond that first year. That's why, well, one of many reasons that I still stay in touch quite frequently with Daddy O-Pops Bill Hartman. So there's my spiel for new grads. I hope you guys thought that was useful. Last question, another one from James. Zach, what are your favorite questions that you like to ask employers? And I thought about this for a while because I don't necessarily have like a set of questions that I ask every employer that I think are important. I think it's very idiosyncratic to the organization because, yeah, Kyle, man, I'm telling you, the loans suck. So I hope you're getting a good paying job to get them shits paid off. Do it sooner rather than later, fam. I'm telling you. But anyways, back to the question. What are some questions you would ask an interviewer? It really depends on the job and what my things that I value are at that given time period. And so, for example, the last job, this job right here, because I did have an interviewing process for travel PT. Now, the job's not right here, by the way. It's like it's over there, way over there. Actually, it's not way over there. I can walk there, but neither here nor there. Some of the questions. So what were important to me for a clinic? Well, I want to make sure that I can get one-on-one time with patients. So that was one of the questions that I asked. So I basically asked, how does the clinic run? What's the schedule like? How much time do I get with patients? Is there downtime? What are the expectations for downtime? So why did I ask those? Well, I thrive when I have one-on-one time with patients, and time, most importantly. And if I'm not thriving at work, fam ain't happy. So I want that first and foremost. The other thing is, if there is downtime, how can I spend it? Because a lot of my downtime at work is stuff like this, or stuff with ZachCouples.com, or checking my email. I gotta get better at that. But the point being is there's things that I want to focus on in my downtime that will better me, not necessarily spend time cleaning equipment, as an example. Not that I wouldn't do that, but if I can spend time doing things that are important to me, I'm going to do that. Or spending time reading or researching or something like that. That's mostly what my downtime consists of. So those were some of the questions that I asked this employer, and it was a good fit, so I accepted. But other things that I like if I'm not doing a travel job, that I will ask is, what's your continuing education policy? In the sense that, do you guys offer continuing education? Do you guys bring people in? What's your budget look like? Those are very important questions for me because, especially early on, I was a con ed junkie. I still kind of am. And it also gives me an idea of, do these guys value their clinicians? Do they want to help them grow? Do they value learning? Do they value good quality of care? So I think that's always a big one to ask. Another one that I like to ask is, where do you foresee the company in 3 years? And maybe they'll say, well, we're hoping that it grows by this amount, and we want this, this, and this. And I say, okay, good. What's your game plan to do that? Because I want to know what the future is of this organization, and if they have systems in place that I think can help them get to wherever their future spot is. And if the system doesn't sound good or they don't have an answer, might be a red flag. Because I've definitely been in a situation before where I worked at a startup and it was a question I didn't ask, and there were a lot of bad things going on at said startup in terms of processes that weren't going to help this clinic grow. Had I known that ahead of time, I probably still would have taken it because it got me to Arizona. But had I known that ahead of time, I would have had a little bit more hesitancy at taking this potential job. So I think it's important to understand what their aspirations are as a clinic. So figure out what's important for you to be successful as a clinician. That's probably the biggest one. Make sure you ask questions relevant to that. And then I would ask about the future of the company. I think those are really key. If you can also job shadow, which this was a good suggestion by Lucy, who I think is listening on Facebook, or see if you can find someone in the company and ask and say, hey man, what's this place like? Those are incredibly telling ways to find out the real answers about wherever it is you're looking to work. So those would be some things I would consider as potential questions to ask. Yeah, I would say those are probably the big ones. But other than that, I think that's all I got for tonight, party people, unless anyone has any questions to ask me. So I'm going to start my little, respect, Lucy, respect. So thank you guys for listening in. Where can you find more? I'm glad you asked. So first off, you can go to zachcouples.com. That is the big spot at which you can check me out. While you're there, sign up for my newsletter. You will get my #weekend learning goodies every Friday, which I give you guys whatever it is I come across on the internets and then some. It's really cool. I would check that out. You'll also get a free acute to chronic workload calculator, a free basketball conditioning program, and a few other things that are exclusive that you would be hard-pressed to find on the internet otherwise. And also, guys, the 2 talks that I'm giving, I'm going to put them up there for my newsletter peeps. So go ahead and check that out. Also, while you're there, do you need some mentoring? That's me putting my arm on your shoulder. Internet-wise. Do you need some mentoring with potential patients or clients? Heck, you want to review anatomy? I mean, do you need someone to bounce ideas off of? I can be that guy. Check out the services page on zachcouples.com. Also, if you're a little tight or you got some discomfort and you tried PT and you ruled out the big bad stuff, I do movement consultations as well on there. We can help restore joint variability and hopefully get you moving and grooving a little bit better, and life will be good for you on that. That's also on the services page. Last thing, I also offer online training. If you guys need help post-rehab, if you are trying to do some fat loss, if you are an athlete and you need some help getting some gains, I'll be your guy. Check me out on the services page on zachcouples.com. You can also find me on Facebook, facebook.com/zcouples. Come check me out on that. I'm also on that Instagram, baby. Instagram.com. My handle is Zach, Z-A-C Couples, C-U-P-P-L-E-S. I'm also on Twitter. My handle is ZCouples. You can also check me on, that's you guys, YouTube. Just search Zach Couples, but I think it's youtube.com/user/couplesperformance. I think those are the only spots you can find me unless you want to come to Page, Arizona. So otherwise, you individuals, you beautiful, sexy people, stay classy. Keep it real, but not to the extent where things go wrong. Stay hungry, stay learning, stay moving. And I'll see you next time. Deuces. Finish. Yep. Nope. Bye. Bye.